Welcome to Pragmatic Talks, a podcast and video series where we discuss startups, contemporary digital product development, modern technologies, and product management. I am Wiktor Żłonowski, a CEO of Pragmatic Coders. In today's episode, together with Mila Klinkovich, we'll interview Cindy Salas, the CEO and founder of WithHealth, promising digital health startup from Atlanta. WithHealth aims to provide precision care to make healthcare accessible, affordable, proactive, and personalized for employers and their employees. Listen to the history of WithHealth, their challenges and opportunities during the COVID-19 pandemic, and get brilliant advices for fresh startup founders. The first question, who is Cindy Salas and what is your story?
Well, thank you. And thank you for also hosting us and our team. I know it's been definitely a highlight for us on this WithHealth journey. So who's Cindy? Goodness, I always think of this little girl with curly hair and crooked teeth that's been curious her whole life and has always like to be outside and turn rocks over and move things around and see what happens as a result to it. But in reality, I am just that, just a lot bigger. Not much has changed. I'm a molecular microbiologist by training. I had great joy in becoming a scientist. But at the end of the day, what I really do is I love people. I love being with people. And I had an amazing mentor who said to me, Cindy, go run a hospital somewhere. And so I did. I went back to school and I learned to do just that. And I was able to run medical groups and hospitals. And as a result of that, I gained this even ever-growing passion for people because I was able to spend time with people at the bedside, with their family members as they saw their loved ones pass. And it really has shaped me who I am today and building what I've built today. If you ask me in a nutshell, who am I? I'm a person that loves. And I have to tell you, one of the highlights of my trip, and really it has only just started, has actually been visiting Auschwitz. Yesterday, a couple members of my team and I went to Auschwitz, and as dire and difficult and emotional as it was, it gave me this renewed passion to do everything with love, to come at everything from love. Because if we did that, history will never repeat itself. If we come from a place of love, then we understand people better. We let curiosity lead us instead of judgment lead us. And so my belief is that if we can live our entire life through a lens of love, then it changes the conversation because we don't have to look at people as adversaries. We look at people as our partners. We look at people as a part of the fabric of who we are. And so then we treat each other differently. We treat each other with respect and finding the best in all people. And so I'm a mother of two. I have two beautiful daughters, and 14 and 8. My 8-year-old will be 9 in just a couple weeks. But I have this love for them, and they've gone on and become these incredible, loving little humans. And so I'm a mom. I after work, I cook dinner. I love to cook dinner, and I love having people at my house. And every night before I go to sleep, I like to tidy up my house. So in the morning when I wake up, everything is set and I don't have dishes in the sink. And so just as much as I get up at 5 in the morning to do my meditation and spin on my bike, and do my readings on the latest in genomics, precision care, and microbiome, and then work with an amazing team, I then come home and enjoy time with my kids and clean my house and get ready for the next day.
It's really inspiring. I believe for many of people who will be watching this, that will be inspiring. Like, because we are recording it mostly for startup founders, so
fun.
this
Yeah.
kind of story, like who you are and what you are doing after work, and actually you show that you are a normal, regular person who you have your own life,
Yeah.
your family, and aside of the very exhaustive startup founder's job, you have a normal life that you are living, and you have a passion to what you do aside of the family and regular things that you do at home.
Yeah,
That's
and
very
they're
awesome.
watching. They're
Yeah, they
watching.
are
The
learning.
kids are watching. They're learning. They're learning from us. So if you're stressed about work, they're going to believe that's what work is about.
Yeah.
And so really taking a glance at how we react to stress is so important, especially if we have family or loved ones around us, because they'll assimilate.
Yeah,
And our friends will too.
I think we'll come back to this. I will ask you a couple of questions about the challenges that you faced or other things in a moment. So I believe we'll be talking about stressful moments
Awesome.
as well. So
Awesome.
let's keep moving. So what is a WithHealth?
WithHealth. So WithHealth is a genetics-based healthcare company, and we provide care for employees. And so our focus is to help employers improve the lives of their employees. As an employer, Victor, you know just as well as I do, we have the responsibility of the people on our shoulders. When you go to sleep or I go to sleep, I know this for myself, we think about our team. When we're having moments of gratitude, we think about our team. And when we're having potentially fearful moments, we think about our team. And so helping employers improve the lives of their employees is important, because employers, especially today, need the help. We're having the employees walk out. We have the silent resignation going on. We have difficulty in attracting and retaining talent. I mean, this is happening everywhere, all across the globe. And so really being an enabler for employers is very important, and to do it in a way where it's affordable and accessible for everybody. So by providing this concierge precision care service, we're able to deliver better care and create precision care plans that are tailored uniquely to you. So not to the general population. This is not trial and error medicine. This is taking the latest in genomics, taking your clinical information and creating a map of what will lead you to have your best health outcomes.
So what you are doing is a precision healthcare plan for the employees. And actually your clients are employers, not the employees.
Correct.
Could you name a few of your clients? Because I know that there are some big names. Or is it
Yes.
confidential?
Yes. Well, no, we can. We can
Sure.
actually name some of our clients. We've been very privileged to have clients like Humana, which is one of the largest insurance companies in the US, and really being able to care for them has been amazing. We have quite a footprint in the production space. So we have clients such as Netflix and Apple and Amazon. And so we've been very privileged to serve clients such as those, and now have a patient care base that we've been able to care for more than 480,000. We've been able to deliver more than 480,000 visits. And so we're very grateful for the opportunity to do that. And quite frankly, Victor, as you know, because we've been on this journey together for some time, my friend, we did this growth amidst COVID. We were on the precipice of launch and COVID hit. And so, quite frankly, to do this type of growth, to take on this type of growth in a time of COVID, where we're able to acquire clients, we're able to then engage the employees so much so that they're willing to take on the care that we deliver is quite exceptional.
Maybe let's talk a little bit more about it, because I remember that you did a brilliant pivot at the beginning of the pandemic. Instead of following your plan, your idea, your initial idea, you pivoted a little bit, but still managed to acquire clients who already are your clients for the precision care.
Correct.
But you did it in a different way. So could you tell us a little bit more?
Yes, absolutely. So the way that I saw it is we had genetic pathologists, we had physicians, we had nurses, and the pandemic hit. So now what? What do we do? And so the first thing, I live in San Diego, California. The first thing I did was picked up the phone and I called the county of San Diego and I said, what can we do to help? And so we became the first telemedicine provider to the county of San Diego. Our purpose was really to take patients from the emergency rooms, from the hospitals themselves following a hospitalization that had COVID, bring them into an alternative discharge center. It was actually dormitories for a university that had never been used before. And we brought our telemedicine kits, we set up the cameras, we set up all of our biometric testing devices that we include in our precision care kit. We did everything except the genomics, and we set it all up so that the county could open up. All of the private hospitals would send the ideas, they would send the patients over to this alternative discharge center so then they can open up more beds to take care of more patients with COVID. And so we were able to help the county in that way. And very quickly, we started speaking with the insurance brokers that actually sell our services to employers. And they kept asking, how can you guys help us? We need help. And so we had a way of doing a risk analysis. And so this is part of precision care, is to do this health assessment. And so we were able to take that health assessment and move it from just a clinical practice within the medical record to actually move it into a clinical practice that we can serve employers and do risk assessments of their employees to help them figure out, what do we do? Can we bring our employees back into the office? And so with that came the knowledge that we needed to do testing. And so knowing that we had a genetic pathologist, we had all of the equipment that's required to do genetic testing, very similar equipment that's required to do COVID testing. So we acquired a few more pieces of equipment and very quickly it stood up our lab. After having worked with partner labs, we stood up our lab in record time. And so our high complexity laboratory is located in Atlanta, Georgia, in the Atlanta, Georgia area, which has really served us well. It's a very central place, and there are very, very smart people in that area, of course, so it gives us a large talent pool to reach into.
Perfect.
It's fascinating how for the majority of businesses, COVID was kind of a doomsday, yes, because business had to shut down and employees had to go home. But in your case, it was quite the contrary, because you managed to take this situation and turn it into something more positive by providing healthcare and help to the people that need it most. So I think that's very inspiring. But going back to the beginnings of WithHealth, I wanted to ask you how it all started, because I've read that you wrote the business plan on the flight back home from New York. Yes, is that true?
That is true, and I still have that yellow notepad.
Wow. Okay, I think that's a very intriguing start to a story. Could you tell us a little bit more about the beginnings of WithHealth?
Yes, and if I could share with you one thing that is so very special and unique, and thank you for asking me today of all days. Today is October 17th. Today marks the 5th anniversary of WithHealth.
Whoa.
Wow.
So
Very much today.
Congratulations.
Okay.
Thank you. Thank you. It
Congratulations.
is our 5th anniversary.
Perfect day for an interview.
Perfect day for an interview. Perfect day to be here.
Exactly.
Actually, perfect day to be here, because so much of us would not be here if it wasn't for you guys.
So we are going to celebrate tonight.
Oh, yes, we celebrate every day. So,
Okay.
but yes, tonight
Tonight will be
especially.
special.
Tonight
Okay.
especially.
So perfect timing.
So
yes.
yes, so wonderful. Yes, I do actually have that yellow notepad. sad. It's still at home, and I keep it very close because it is very special to me. And it was actually far more somber than, as you mentioned it. I actually got on the plane in New York, and I was sad. I was actually very sad. I had just done a executive roundtable, like 7 or 9 days, something like that, and meeting with healthcare executives all across the United States. And I was with Senator Tom Daschle. He was one of the authors of the Affordable Care Act for the US. And he and I had done these executive roundtables. And I remember being on the plane, and I was so very sad, because every executive that we spoke to had that pain in their eyes. They wanted to do more. The healthcare executives want to fix healthcare. They want to do more, but they were absolutely devastated. And it's, if you know there's a problem and you feel like you can't do anything about it, that hurts. That really hurts. And so all of these executives are looking for the right answer. They're looking for the solution for the problem. And the problem is access, and the problem is cost. And with that in mind, I got on the plane, and I'm a joyous person. I live life on the happy side, as they say. I really enjoy my life. And I feel very blessed for every moment that I get. And at that moment, I felt the sadness. I felt their sadness. And it was painful. It was painful, and it's not a place that I normally like to live in. And so when I got on the plane, I was sad. And then I thought, okay, I'm done being sad. We got to fix this. We can fix it. And so I felt this moment of inspiration. But I think what it really required, and I think is probably the most important piece that I don't often speak of, but I think what's really required is being open to that inspiration. And I was. And I was open to that inspiration. And I think many times when we get stuck, it's because we close ourselves out from allowing that moment of inspiration to happen. So whether it's a gust of air from the universe, or call it what you will, a prayer, an answered prayer, or whatever it may be, whatever you believe, just allow yourself to be open for that inspiration, because that's what I believe enabled this business plan writing. And so I wrote it all out, and I called some of the smartest people I know, and I said, help me. Tell me that this won't work. Tell me how this won't work. Because I didn't want them to tell me it was good. Tell me that it won't work. And so it was a lot of fun. And some of those people are still around advising me today. And so it's really phenomenal to have the backing of such smart people that are interested and willing to make healthcare better, interested and willing to make the lives of people better. And but again, I think it's just being open to that inspiration. And that's really how it all came about, is being open to that inspiration.
That was
and
the start of the journey, yes?
that's how it all began.
Okay. You mentioned that the problem that you were trying to solve was the lack of affordability and accessibility, right?
Correct.
Were there any other issues that you were trying to target when you were trying to provide the solution for this problem?
I would say world peace, but you know. No, that's pretty much it. I mean, if you think about it, that's like wanting to solve world peace, right? Like end hunger, provide health care, provide affordable health care. The reality is precision care has only been available, when you talk about genomics, it's only been available for the very wealthy. People could do our tests today, our services that we provide today. I can give you a list of providers that will do it for $25,000, that we're able to do it at a fraction of that. is really the solution. That's the solution.
That's
so that
incredible.
everybody can do it. Everybody can do it. And I'm talking single digit % of what you can get it for. So you can go off and buy it. If you have $25,000 to spare, you can go off and buy it. Or you can do it with us for single digit % of what that costs. And that's the solution. That's solving healthcare. Because if an individual can afford it and not feel it leave their pocket, then they'll go get the care they need. Oftentimes, people don't get the care they need because it's too expensive. I can't pay for the medicine. I don't understand the doctor. It's so inconvenient. I have to not work today in order to go see the doctor. We solve all of those problems.
Especially from the employer perspective, that makes sense, and is really good. And also for the employer, having healthy employees is also beneficial, so they are more willing to pay for that.
Exactly, exactly. And it increases productivity. You have an engaged employee that's interested in improving their health. I love it. We were talking about earlier about going for a walk. I mean, that's a culture you guys are building here, right? Is that you go take a walk. I mean, that's the kind of culture that I think most employers want to build, is to build a culture of wellness, a culture that actually embraces the holistic employee, the total employee. During the pandemic, one of the things that we learned a lot about was how to be a better employer. We have employers today that are creating financial services plans for their employees because employees, even though they had a job, they lacked cash. Because their spouses lost their job, or they had to cut down their hours because they couldn't go to work anymore. So it was this cascade of problems that occurred. And so looking at our employees now as a person instead of a delivery of financial goods to the company, right? A revenue producing individual, thank goodness it changed, right? Because then people can look at their employees as being a total person. And I had little children. As I said, my girls are 14 and 8 now. 5 years ago, they weren't that. So you can imagine I had a 3-year-old daughter. And it never feels like the right time. I think it goes back to that being open to the inspiration. I think what pushed me over the edge to do it was really understanding if I don't start now, it's never going to be solved. It's a resolution inside of myself that I was solving a problem that was greater than me. It was solving a problem that was greater than even my family. And I think that's the resolution inside of you that just takes the fear out and just pushes you forward. And understanding that you can't lose. There is no loss. There's never failure, I think, and that's the moment where the timing really is just about moving forward. It's understanding that you're solving a problem that's far more intense, that requires your solution, and the time is now. And so if when I talk to other entrepreneurs, because I have groups that I'm a part of, I'm always learning, I'm always growing. And so my own leadership development is very important to me. And so I have a group of CEOs that I meet with. And quite frankly, they're remarkable. But we talk about this, right? We talk about, when do we launch the next product line? When do we open, the next clinic? When do we open the next office? And when do we know to expand the team? It's really when the problem becomes so great that you have the answer, failure is not an option. It's not going to happen. And the worst case scenario is that you learned a massive lesson. And at that, if you get to learn a big lesson, which we all do along the way, right? Every moment we have lessons to learn. Every time we learn that lesson, then we have the opportunity to share it. And so it's you can't lose.
In worst case scenario, you will build on the top of these lessons later on in the next endeavor and the next endeavor and then next.
Exactly.
So yeah, this is great.
And hopefully somebody will learn from my lesson,
Yeah.
right? And stand on the shoulders of that.
No, this is also perfect. This is a topic for a different discussion about team building, about leadership and growing people in the teams. I hope we'll have time someday to discuss this as well. But let's focus on your journey and on your product on WithHealth and how is it going. So
I know that you've mentioned that definitely COVID, yes, the pivot, yes, regarding the COVID situation is probably on the top of your list, I imagine. But are there any other achievements that you would like to share with us?
I would actually say that wasn't one of the greatest achievements. I would say the greatest achievement is hiring some of the most incredible minds and watching them build WithHealth. The one piece that I can't delegate as CEO is vision. And so providing a clear vision is really my duty. That is the one piece. You just can't delegate that. Everything else can be delegated. And so what I have found in my career is that hiring people, working with people, empowering people that are smarter than you is the easy ticket to success. So if ever you want to be successful, you hire somebody smarter than you that can do it better than you, and you bring them on your team. And you ensure to inspire them, and you give them the tools and equipment that they need so that they can do their job well. And if you ask me what's the greatest accomplishment, is that the WithHealth team has built something that is truly revolutionizing healthcare. That the WithHealth team has designed a product, and you guys are a part of that WithHealth team, designed a product that will change the way healthcare is delivered forever. And that is not me. That is not me. I had a vision, but a vision doesn't actually make it. It's the team that has made it. And it's their ideas, their inspiration. And so just like on our trip this go round, we're doing some ideation sessions for the purpose of that. And it's one of my favorite things to do because you just throw something out there and you see just brilliant minds at work. And it's so energizing and inspiring because you actually see it all coming together. And you go, oh man, this is even better than I even imagined. So it's super fun to sit in that space and you almost become addicted to it. So you gotta be careful to not do it too much because, I love shiny red objects and I could get distracted with shiny red objects. So I have to be very mindful to not go looking for shiny red objects.
Well, I must admit that you are doing this really great. Since I am observing this from my perspective, when I see how our team that is working with you, how they are inspired by this vision and how they love to be a part of it, and how much motivated they are to actually follow this vision and deliver it. And I believe that creating this kind of teamwork and this kind of environment where everyone have something to say, everyone have something to add to this vision to build on the top of that. This is really awesome, and we already see the effects of that, the results. So this is really great.
Thank you.
So yeah, but it started from the vision that's and the way how you sell this vision or actually deliver this vision to others.
Well,
So it's
thank
great.
you.
Yes, they do say that teamwork makes the dream work, right?
That's true. That's right.
Yes. Okay, so we've talked about your accomplishments, and now as a contrast to that, I wanted to ask about the most significant challenges that you faced during your business journey.
Oh my goodness. I have a laundry list. I have personal challenges, I have business challenges, but I'm so happy you call them challenges and not failures, because they're only failures if you don't learn from them, right? So challenges, I've had many. I would say some of the challenges have been around building team, have been around hiring the right person at the right time. I feel like I've made the decision too quickly, where I should have paused more and thought more about it. But I was impulsive and moved too quickly. And so I think that's been a challenge also. And I want to be super careful as I mention this next challenge, but the next challenge is one that straddles me both on the personal and the professional side. I'm just going to tell you how it is, and that is trust. I'm very trusting, and so I have a tendency to trust people, and I trust them very quickly, and so that can seem like a good thing, right? And it, I believe to a certain extent it is. But also what I have noted in that trust is then I quickly let go, which again can feel good, right? Because I don't micromanage. People that work with me will never tell you that I micromanage. I very much work with people that are so smart that can just carry it out. And what I've noted about myself, and it's something that I constantly work on, is because I am very trusting, then I let go, and I let go very quickly. And so the touch points that I make become further and further apart. And so I may need one-to-one meetings every week, and then I don't need them as much because I trust what's happening. And so it's in the communication of that that I think has been challenging for me. And also by being over trusting, then I don't always go back and validate. And so that's challenged me a lot, because there have been things that I've trusted that have been done, and then I go back and I see that they weren't. But then I look at it from the perspective of the other person. They believe they did it. But because I didn't tell them that it wasn't done to how I saw it, then in my mind's eye, it was never done. And so that, by being over trusting, it can actually make the waters murky for the other person. And so that's why it's a challenge. It's not so much about me, but it can make it challenging for the other person. And so then it does make it about me, right? Because at the end of the day, I'm the one that's over trusting. I'm the one that hasn't validated. I'm the one that hasn't gone back and given feedback. And so I think that really is one of the biggest challenges. And it's a challenging thing at home, and it's a challenging thing at work, is by being over trusting, you just assume. And so not over assuming has been the name of the game for me. And I continue to work on that.
So let's imagine that we have a time travel machine.
Oh,
And,
yes.
What would you do differently if you go back in time, in this 5 years back in time, and what would you change? Is there anything that you will change?
Oh my gosh. Oh.
Or what would you tell yourself to do differently? Like, you have one chance, just one thing that you would change. You would change.
Oh, I don't think I could say it on camera.
Okay. Okay, so maybe later off the record.
Oh yeah, off the record, I'll
the
tell
record.
you. Off the record, I'll tell you.
Okay.
No, oh gosh, time travel. So I don't think I would change anything.
But maybe you will give
But
yourself
what I would
advice.
give myself some advice.
Yeah.
Yes, exactly. That's exactly what I would do. Is I would give myself some advice. And that is slow down.
Okay.
Slow down. Because if you took just a little more time on this decision, you might not make it the way you did. So I wouldn't tell myself to make different decisions, because I think all the decisions I make have shaped me who I am today, and I'm grateful for that. But I would tell myself to slow down. And even just on Thursday of last week, I was telling myself that. I was telling myself, slow down, Cindy, slow down. Because I think when we go so fast, we want to do so many things, and we want to make very quick decisions. And you know, as business owners, we think, oh, it's revenue. Let's get it. But if I slowed myself down and really thought about how good is that revenue? Are they the right partner? Because as much as when you bring a client on, you're bringing on a member of the family, because that's how we treat our people. They're members of the family. And so would you want these people at your dinner table? Would you want this client at your dinner table? And so by slowing down, then you have the opportunity to really ask that question. And when you're moving so fast, you just want to go get it. So I would tell myself to slow down.
I totally agree with this. This is something that I'm also learning as a founder, as a business owner. Okay, so we already spoke a little bit about the challenges, about what you would change, or actually, what advice would you give to yourself? So maybe let's talk about your current plans and some exciting projects that you are working on currently. So what you are working, what we could expect in the next couple of months from WithHealth.
Yeah, well, it's very exciting. The nice thing is you guys know what to expect because you're building it every day for us. But really, what's super exciting for us right now is really, as our clients come on board for precision care, just the lives that will be transformed, the outcomes that will come from this, and start publishing those is really exciting to start sharing some of that information of the early adopters. I think as those outcomes now start to be produced, that's very exciting for us. So being able to put that information out there. Also, our microbiome work is truly tremendously exciting. Our algorithm has now been used with over 15,000 patients, and remarkable outcomes with autoimmune diseases, mood disorders, just gut disease, gut illnesses, gut diseases, diabetes, cardiovascular disease, really have been transformational for these patients. And so it really is super exciting to get that into the market, to make that available, and to have one of the leading experts on our team that has helped us build that algorithm and test that algorithm and seen the benefits of that algorithm with 15,000 patients is really remarkable. What we're doing is microbiome modulation, and it's not just, as they say, the poop test. It's not just about what grocery shopping you should be doing, right? Or what supplements you should be taking, but we're actually coupling the microbiome work with our total precision care plan, which ultimately takes everything into account. And so as we see diseases, chronic diseases increase and at an all-time high, we're going to be able to show the amazing improvements that we've made. And so I'm super excited to bring that to market in the coming months.
So we can expect that there will be a new app that will help people take care of their health and their lifestyle as well. Am I correct on that?
Yes, absolutely. Absolutely. And thank you for building it.
It's a pleasure, actually. So where would you like to see WithHealth in the next, let's say, 5 years from now?
So I would like to see WithHealth in every doctor's office, in every clinic, in every hospital. I believe that, I mean, if we think about genetic information, 23andMe has sequenced more than 5 million people. Let's put that information to use for your care. So the only way to do that is if we can make this available and accessible to everybody. So then those that have gone through their genetic sequencing can take benefit from it. And genetic sequencing, as we know from our partners at Illumina, it's becoming more affordable. We're doing it at incredibly affordable prices where it's still sold very expensively, but we're doing it because we don't see the patient just as one moment in time. We see the patient as being a part of a health journey with us. And so when you have patients already have their genetic sequencing, then let's get into every doctor's office. Let's get into every clinic. Let's make this available to everyone, because then it's just about ingesting the information, putting it through our IP, putting it through our algorithm, and helping those physicians make better decisions.
We talk about that, for example, some drugs that are prescribed to some people are actually incorrect because they won't work for the person with such a genomics genome, and so maybe this is something that we can elaborate. You can elaborate a little bit more, like why is it important to include genomics and also this patient history. Those two combined, building a platform for that is very important and makes the healthcare more effective. Actually, at the end of the day, it's also making it cheaper.
Yes, absolutely. And so genomics, if we think about it, it's very important. It's very important, but it's not the only thing, right? There are people that struggle and may not want to use their genomics. They may have some kind of fear, and that's okay. But still bringing their health record into one place, having one physician actually taking that health record, getting blood work, and bringing it all together into one view enables a different picture for that patient. So when you layer in the genomics, we then better identify, do you metabolize this drug better? Is your genotypically, which is, your variant inside, what your genetic code may say that you're predisposed to something, but phenotypically what you physically exhibit hasn't happened yet. And so the work we're doing will actually allow us to better understand when can we phenotypically see that when can we see that shift occur? When can we see, in what timeline, at what time frame can we actually see the patient's variant actually manifest? Or do we ever? And so by being able to have that level of information, then what we're able to do is either one, slow down the progression of disease, or two, reverse it. And so the name of the game is prevention. And so one of the things that I was talking about with the team, our development team and, all of us together, is that really understanding that it's all about prevention. And if we can actually look at our practices, what makes you brush your teeth every day? There's something that drives you to do that.
Yeah.
Well, I hope. But and it's
days,
not like
couple
my
of days.
kids going, "Did you brush your teeth yet? Did you brush your teeth yet?"
What convince you, mom?
Exactly. But again, what drives you to do the things that you do every day? You have a watch. You put your watch on every day. What drives you to put your watch on every day?
Just measure my steps, my blood rate, BPMs.
Yeah, exactly. So everything, you have a reason for using that, right? Something is driving you, something is motivating you, something is inspiring you to do that. So as we look at our patients, let's look at them from the perspective of us coming to them. Let us, we work with a lot of productions, right? And so we are not the stage. The clinicians are not the stage. The patient is the stage. So let us be the supporting cast. Let us be those that stand backstage. Let us be those that build the stage. Let us be those that put the light on the stage. Because as you know, it's not just the talent that's doing the movie, it's all of the people that are there, right? That are building this movie. That's why when you go to the movies and you have the long list of credits, you know, most people are out the door when they start the credits, but I think it's nice to stay put and be respectful.
Not if it's a Marvel movie where, you know, they have these
Where you go,
scenes
all
after.
your, yeah, exactly. Yeah, right. They were very smart to
Very
do
smart
that.
with this.
Very smart to do that.
Exactly.
And I like to stay behind also, not only to see the names of the WithHealth employees on there, because we've been able to support so many, and so they're there. But not only that, but it's out of respect because it's those, you know, the supporting cast. But going back to that, it's really let us be the support. Let us be the support and come to the patient stage and really be that enabler for them.
Perfect. Maybe let's move to the next question. So since we are working together for over 2 years already, so was there anything that surprised you, or maybe you can share your experience from working with Pragmatic Coders?
I would say working with Pragmatic Coders is really a privilege. And the reason, and I say that whether you guys were here or not, I really do feel that way. We've worked with other developers and it was great. And I'm very grateful for those experiences, and we were able to accomplish things that we needed to. The difference is that working with Pragmatic Coders, you really became an extension of the team. So what it feels like to us is that it's not that we have a vendor. It really feels like they're just members of the team. So even when we say partner, it's family, right? It's like you're part of the family, part of working together. And so when we have meetings, to be able to share with you exactly what's going on behind the scenes, to be able to have somebody that sits at the table with you, and you and I have had conversations where it's like, oh gosh, we're having a really rough time right now, and what you've shared with me has always been your success is our success, and so I take that to heart, and so I think, you know, when I am grateful for the team and I think of, gosh, you know, I'm so grateful, feel so blessed for all the members of our team. I envision Pragmatic to be a part of that. And so I think one of the things that, if you ask me, what has been that linchpin moment for me that actually has made it feel that way, is we brought on a very large client over the holidays. And it was such a heavy lift to make this happen. And the requirements were so massive. They weren't just little easy requirements. And as you know, I have a tremendous passion for patient safety and patient privacy. And the beauty of it is you guys do too. And so, given that we have that common spirit, then we know that that's something that we need to move forward with. And so we do it with the utmost of care. And gathering that we were bringing on so many people and that upload was just so massive. It really, that moment in time for me where I thought, this is, you guys are our family, we are one, is that incredible upload that occurred that weekend. And it was your entire team that was available, that was working with our team shoulder to shoulder. And I was getting the updates like every 4 to 5 hours. And it was so incredible to learn that partnership existed. And our team just loves working with your team. And it's just, it's so great. So I would say it was that moment in time where, everybody put everything aside. And it was a time where people are getting together with their loved ones, with their family, that they're going to parties and they have celebrations to do. And yet they stepped up and sat at the table with us when we needed them the most.
I'm really glad that you shared this story. Usually we try to not to work over hours, but when the situation needs that, the team is there, and this is, as you call it, a partnership. Like we are in this together, and as you mentioned, actually quoted me that your success is our success. So yeah, and. Yeah, this is how we work and what we believe at Pragmatic Coders, and I'm really glad that works actually. And you are sharing your experiences from that.
Yeah, so much so that as we were just reviewing our product roadmap, um, one of the ways that as we envision moving forward and really making this open and available to all physicians, right? All medical groups, all hospitals, as we go in that direction, um, you're a part of that journey. You look at all of the technical integration that occurs. That's here, right? That's our team here. So it's not something that we view as a tactical relationship. It really is a strategic relationship. And if you're bringing on a new client, I would say the key to success, and I would tell that client that, is that the key to success of working with you is not to become tactical. Don't give you a checklist and just a checklist. I think checklists are important because you still have to deliver on the product, but I think the greatest mistake would be to just work off a checklist and not open the gate of strategic, because really the opportunity is to work together to strategically develop the product. So as strong of a product owner and a product manager as you may have on inside the walls of your company, stateside or wherever you might be, being open to the knowledge that you have a global team that is incredibly trained and prepared to lock arms with you and be strategic. And so to be open to that. Again, surround yourself with people smarter than you are. So
Thank you. Okay.
Throughout this entire interview, you already shared a lot of amazing tips for future startup founders. But I was wondering if you could give us some more tips or some lessons that you would like to share with future entrepreneurs.
yes. So I'll give you just a few. So one is start your day with gratitude and end your day with gratitude. And so I have a practice called favorite moments, and I do this with my children. And here I am, 9 hours plus my time zone, and I still do the phone call with my kids when I go to sleep this time. And if you look at my phone, they left me a voicemail giving me their favorite moments when they went to bed. So starting your day in gratitude, ending your day in gratitude, I think is a good way of living. I think that's first and foremost. I think the second piece is surround yourself with really smart people. And so, how do you know that? Then it's to actually let go of your ego. That's the best way of doing it, is to really look that things are not to be captured and created alone. They're to be created together. We're here to co-create. We're here to make magic happen as a total population. One of the things that I'm really grateful for the pandemic is that it has allowed us to really become more of a global community. And having our postdoc in Poland is so incredibly exciting. Having some of our project managers in Paris is so incredibly exciting because the footprint is just growing, right? Having folks in London, having folks in Amsterdam, it's so beautiful because we become more of a global community, and it allows us to better understand others. So I would say part of that, though, is letting go of your ego. And no matter what you believe, whether you believe in God or you just believe in love, I believe ego, some people said it's etching God out. I believe it's edging God out. It's edging love out. And if you're focused on egos, so the ego, edging God out is to think that you don't want love in your life. You don't want God in your life. You don't want to believe in the universe and the universality of who we are. I think by letting go of your ego, then you're open to love. You're open to other possibilities and open to knowing that you don't hold all the answers. Another piece of advice is have really good contracts. I think that oftentimes we come together as friends and we just want to help each other out, and then somebody makes a decision or you make another decision, things don't quite work out the way that you want things to, and then you have contracts that don't necessarily work for both parties. And so I would say be mindful of those contracts. And even though many of us think it'll never happen, I think it's important to have solid contracts so that you protect yourself and protect your family and protect your colleague and protect your colleague's family as well. I think those are important. And the last thing I would say is make raving fans out of your clients. And by making raving fans out of your clients, you have to actually start with your employees. So be really mindful in how you take care of your employees. They're people just like you, and they're not a commodity. And I think really focusing on creating raving fans by loving your employees, by taking care of your employees and creating raving fans of your clients will come, because then they become so minded in caring for your employees.
Thank you.
So, the last question. Is there anything else that we should ask you about and we didn't? Maybe there is something that you would like to share or add to all of these things that we already spoke about.
So if you ask me if I have anything to share, I would say we're at a very interesting crossroads right now as the market is changing. And some countries are experiencing a recession, other countries are experiencing slowed growth. I think one thing that we all know, and we're hearing from economists across the world, is that we do expect a depression to occur in 2030. And so knowing that and knowing the way that we're structuring at WithHealth, making it affordable and accessible for people to receive care is important. And it's what I like to call, we're making it depression proof, because when a depression occurs, everybody feels it, and it'll feel stronger in some countries than others. So if I wanted to share anything, it would be that, is that in our conversations, in our needs assessment, I never expect the worst to happen, but I do understand that we must prepare ourselves in the event it does. And so what does that mean? What does that mean to you? What does that mean to your business? What does it mean to your clients? And then looking at your client list and saying, am I focusing all of my efforts on just one client, or do I have a series of clients, and are my clients in different spaces as well? Are they in different industries? Am I diversified enough? Is my client group diversified enough? And so I think it's not about fearing it, but I think it's that it can occur around us, but we can make it so that we don't feel it. And so I think it's a way of looking at it not as a doomsday on its way, but instead of an opportunity for us to look at things in a more efficient way. How can we do things? We can do more things for our clients. How can we do things to better serve our population, better serve our community? And I think with that, then we do become depression proof.
And I think that your example with starting the pandemic, when this pandemic started, and how you reacted to that, and how you use your resources to actually solve the real problem is a great example of how to deal with the incoming depression or recession.
Right.
Yeah.
Right.
Okay, Cindy. So thank you very much for visiting us. Thank you for your time. Thank you for all of this answer for our questions. I hope we'll have a chance to talk even more. Maybe we'll record some video again in some time, because I believe that we have a lot of topics that we can cover, especially the mentioned leadership things and other stuff, because I think
I'd
you are
love
a
to.
true leader that it would be great to discuss this topic as well. So maybe somewhere in the future we'll have a chance to
Well,
talk
as
again.
you, I have tons of questions to ask you.
So, of
You
course
have
we
a lot to tell.
we can have this interview in the other way as well.
Exactly. That sounds wonderful.
Perfect.
Sounds
So,
wonderful.
thank you very much.
Thank you so much.
Thank you.
Thank you. Pragmatic Talks is delivered to you by Pragmatic Coders, the first choice software development partners for startup founders. Be sure to catch all new episodes. Subscribe to our YouTube, Spotify, or Apple Podcast channels. And if you are thinking about building your own startup or struggling with product development, contact us and find out what we can do together.